have and what functions that
Sure.
they offer.
So I'm actually wearing the watch version. There's actually also a pendant version and a belt clip version. And essentially, it's a wearable cellular device. As I said, it enables mobility and location-based services through GPS. But then it also enables things like activity monitoring, which is very critical. So you can measure steps, we can measure levels of activity, and then we can also detect a fall. So if the system detects a fall, it would open up a voice channel directly from the device to a back-end call center, and then that call center would be able to locate the individual. We'll also be capturing a personal information record on the individual when they sign up, so we'll have relevant data about the individual, so that emergency response agent can then know who they're dealing with, know where they are, determine if they need emergency assistance, and if so, route that call to the local public safety answering point that has jurisdiction over the geographic location, and then deploy the appropriate emergency response to that individual.
Who are you targeting here? Are you targeting just the elderly, or is this appropriate for other audiences?
So it is appropriate for other audiences. I think what we're kind of following the crossing the chasm concept of establishing your beachhead and then expanding from there. So I would characterize our beachhead as the active seniors, but I think it'll also suit very well the traditional PERS customer, as well as potentially kids and other folks that have health issues that may need access to emergency services.
So you might imagine a diabetic child wearing one of these, or maybe somebody that's got a serious heart condition?
Yeah, potentially. In fact, when I was working with you, we did a lot of market research in this area, and we found that what really characterized demand was what we refer to as a life event. So as opposed to age, which is certainly a factor, we found that individuals that had a life event, whether that was a health issue, they've taken a fall and ended up on the bathroom floor for 2 hours, or as simple as they've lived with a spouse for 40 years and that spouse has suddenly died, those people seem to have a much higher demand for this type of service and product because they feel vulnerable in some way, and this provides, an added layer of protection. In addition, we're really gearing this towards the caregiver. We found that the caregiver is an incredibly important stakeholder. They're typically involved in the influence and in many times the purchase of these decisions. And so one of the things that's also complementary to the device and the service is a web portal where a caregiver can go onto a web portal, they can locate the device, and they can set up all kinds of alerts to alert them as to for example, when a particular individual arrived or departed a particular location. So it's really important to try to reduce that burden of care on the caregiver.
So one of your partners is Hughes Telematics, which is the service provider for Mercedes Embrace, kind of OnStar for Mercedes. Who are your other partners, and what's the distribution channel, and when will we see this on the market?
So we'll see this in the market in the fourth quarter of 2011. American Medical Alert Corporation, or AMAC, is the third investor in addition to Qualcomm in Lifecomm. So AMAC, if you're not familiar with them, they've been in the traditional PERS business for about 25 years, and they are going to be our first value-added reseller. They have Medicaid state contracts. They have a relationship with one of the top 3 pharmacies. So they're definitely, and they bring a wealth of experience as well as call center expertise. And then what we're doing right now is working on developing relationships with other channel partners. And we've looked at hospital systems, independent assisting living facilities, managed care organizations, MVNOs that focus on the senior markets. There's a lot of opportunity.
Great, Rich. Thank you very much.
Thanks, Tom.
Thank you. I'm going to call up next Kian Saneii, who joins us from Independa. Kian, thanks for joining us.
Absolutely.
This is not a company Qualcomm has an investment in, so maybe you can tell us a little bit about your relationship with Qualcomm and how that led to the product you envisioned and exactly what your product offers.
Sure. So, is the mic on? So I over the years, we've been looking at where's the biggest opportunity in our mind where wireless technology could apply to health. And we thought the market of I've fallen and I can't get up is really long overdue for an integrated solution. And the relationship with Qualcomm and the fit is that we like to think we're implementing your vision of collapsing time and space between a caregiver and their loved one, who is typically the elderly loved one looking to live independently.
So in your system, and I've got a slide up here, but you've actually integrated a lot of other sensors, the possibility of implementing other sensors in the home. So you've actually got compared to Lifecomm, which is kind of a body-worn kind of sensor and service, you've actually got a kind of a comprehensive, more horizontal kind of platform that you provide. Are you competitive with Lifecomm or complementary?
No, we think we'd be very complementary. What we do is provide caring when you can't be there. So in that environment, you have to have a lot of sensors. You have to be able to tell things like if mom sat down and didn't get up from the couch for 10 hours, or if the front door was left open for 20 minutes, or if there was about to be another flood for the second time in a year. And that list goes on and on. There's dozens of thresholds that you set in our environment. And when you go to work or mom's 3,000 miles away or 2 continents away, you can be notified if something isn't quite right. And I think the opportunity for Lifecomm is for folks like us to integrate with those types of solutions, to integrate and provide a broader solution.
What in your system, what kind of distribution model are you targeting, and who are your customers?
Well, we have multiple tiers. We have direct-to-consumer, which we launched right here yesterday. Those are 3 applications: smart calendaring, medication reminders, and life stories. And we're in the Qualcomm booth, so we're happy to show those to you. We also have a channel program where you could either be a referral, a reseller, or OEM of our product. So if you can imagine, that shows a one-to-one relationship between a caregiver, we're sitting in the cloud, and their care receiver that could be anywhere. But we also have an enterprise console where caregiving organizations can have a view of multiple locations, company-owned or franchise-owned, each with multiple caregivers, each with multiple care receivers.
So at the end of the day, I'm sure the buyer of the service here is looking for a certain level of peace of mind. What are all the ways you're giving them peace of mind?
Well, essentially, we like to think we are there for you when you can't be there. So when you think about all the things that are important, and it's different for different people. So if you're a CHF patient, you might need to take pills, and you might need to get on the scale every day. If you forget to get on the scale, the device, which is Android-based, with a Snapdragon chip running in it, and 3G connection into the sky, that would remind you at the end of the day, Rita, we don't have your weight. Could you please step on the scale? There's RF technologies that make that completely in the background. You just go in the bathroom and step on the scale, and we confirm that was you. That's an important thing that someone else has to manage at a distance today. And again, we collapse that distance in time. We do it for you.
So it's pretty obvious for Lifecomm why they use cellular in their system, because people are very mobile. They'll be outside of the house. You can't have a wire, an Ethernet cable attached to grandma or your son. So, but in your case, you're talking about a device, a platform that's in the home. So why is 3G cellular connectivity so important to you?
It's critical because it is about connecting people, and we make no assumptions. In fact, we're religious about the fact that the elderly person has to not have any knowledge necessarily about how to use a computer, no infrastructure assumptions, there's no Wi-Fi necessarily or 3G or wired. So we have to provide that Kindle-like connectivity for them. Further, everything is touchscreen there, so they don't have to do anything but touch a screen. Single touch access to email, to the web, to puzzles and games and cognitive exercises, even single touch access to video so your caregiver can see their mom while maybe having lunch at work. Beyond that, the caregiver themselves is standard web-based app. So everything is part of the whole vision of without that module connecting you, there is no connection for us to the caregiver.
So with that 3G, you've got drop ship ability into the home, and you don't have to worry about sending service technicians out to do installs, figure out whether broadband's in the home,
Exactly.
get through the security, the router, make sure there's wireless coverage
Exactly.
in the room, it's
Exactly.
installed, etc.
Your point earlier about being consumer-centric on the health side, so we are all about consumers, not patients, about health care, not sick care, about being affordable and easy to use versus a medical device. And so if you don't do that, there's 50 million caregivers in America, 600 million worldwide, that are looking for these types of solutions to grow.
Thanks, Kian.
Thank you, Don.
Nice, yeah. Jonathan Javitt will join us next. Jonathan's the CEO of Telcare, which has introduced the world's first cellular-enabled blood glucose meter. Thanks, Jonathan.
Thank you.
Do you have a device with you?